Hello everyone, myself Dr. Shravan or Shanbhag. I'm a consultant urologist at Indiana Hospital. Today I want to talk few words, share few information regarding prostatic enlargement. We call it as BPH, Benign Hyperplasia of Prostate. First of all, I would like to give a few points on what is prostate gland. Prostate gland is a gland in males. It's a male reproductive gland. It's a counterpart to females, that is uterus. Everyone has prostate gland right from the time of birth, but you will come to realize you have prostate gland only in your 40s and 50s. As we grow older, the prostate gland becomes bigger. That time someone realizes that he is having a prostate gland. What is the function of prostate gland? Prostate gland mainly it is a reproductive organ from which the secretions will help in liquefying the semen, which is required for reproduction. Where it is situated? It is a gland which is situated beneath the urinary bladder, encircling the urethra. Urethra is the passage continuation of the urinary bladder. What is BPH? BPH is benign hyperplasia of prostate. Hyperplasia means increase in the number of cells as well as increase in the size of the cells. It is hypertrophy with hyperplasia. That is BPH. BPH is different from cancer. Cancer is something happening in a very small group of people, whereas BPH happens in everyone. Like our hair becomes grey, our hair is shed in older age. Same way the gland becomes bigger. So BPH is an inevitable condition. It is not a disease, it is the aging process. What is the cause of BPH? Basically, BPH is due to the imbalance in the hormone. The male sex hormone is testosterone, whereas the female sex hormone is estrogen. As the person grows older, due to obesity or due to increased fat deposition, there will be imbalance in the hormone. So testosterone will start coming down, estrogen will start going up. The imbalance leads to enlargement of prostate, which is an inevitable condition. What are the symptoms of BPH and when should you consult a doctor? Symptoms. Mainly the symptoms are divided into two parts. One is the irritative, other one is the obstructive. First thing to come is irritative symptoms. That is, someone wants to go to washroom frequently, even in their workplace or when they are watching TV. They cannot control the urine. They have to go to toilet, to that washroom. That is, the urgency will be there and the frequency will be there, and more commonly nocturia. Nocturia means nighttime passing urine. Passing more than 2 to 3 times urine, which disturbs the sleep. You will have early symptoms of BPH. Other than that, the obstructive symptoms. Obstructive means when the urge to pass is there, they go to washroom, but they have to wait for a long time, and then only they strain to pass urine. That is hesitancy. Other one is the stream will be poor. We have to put lot of pressure to void the urine. And while passing, there can be in between stop in the passage of urine stream, I need to say. These are the other obstructive complaints. Everyone may not have all the complaints. There will be few complaints. Some may have only the irritative complaints. Some may have a few irritating and few obstructive complaints. Invariably, someone becomes old, they will develop all these symptoms. So, whenever such complaints are there, especially after 45 years of age, they have to consult the doctor for further treatment. Now coming on to the diet and lifestyle, which can promote or prevent BPH. The diet wise, mainly the fatty food, cheese, dairy products, red meat. These food are prone to cause obesity, as well as these foods are going to cause BPH. So reducing this diet can help in preventing BPH. Other one is sedentary lifestyle and obesity. Putting on weight can cause BPH. The reason is being estrogen hormone. And the food items which can prevent from causing BPH, exactly not to prevent because it is a age-bound process, but still which can retard the process to becoming more later. That is, eating the green leafy vegetables and eating citric fruits which are rich in vitamin C, antioxidants, that is like lemon, oranges, guava, and eating tomatoes, baked tomatoes, which are rich in lycopenes, which prevent from enlargement of prostate. Eating dry nuts, mainly walnuts, almonds, or pumpkin seeds. These all are rich in zinc, which can prevent from growth of prostate. Now coming on to the treatment modalities for BPH. First of all, it is the medical management and lifestyle modification. Medical management, where symptoms are there, they require medication. Someone is having a big prostate, but it doesn't have any symptoms. That time medications may not be required just because someone is having a big prostate. So the first treatment is conservative. That is when people are having symptoms, you treat medically. Even after medical treatment, someone is going for retention of urine, or his symptoms are not getting relieved, or his kidney is becoming weak due to obstruction, that is rising in creatinine, or he is having recurrent UTI or stones with a significant urine in spite of medications. That time the surgical treatment will take a role. Surgical treatment, it is purely minimally invasive, that is endoscopic surgeries. Mainly, I will talk about the more common on the gold standard techniques than the newer modalities. First of all, the most common standard surgical treatment is TURP. We call it as TURP, transurethral resection of prostate, wherein you go through the urinary passage and you scoop the prostate gland. By that's how you clear the prostate so that the symptoms will be relieved. Other one is by using the same thing by using laser. We call this Hornet per Tulip, which are used in certain conditions. The gland is very big, which is more than 80 grams, or someone who is on anticoagulants because of comorbidities or on pacemaker. In such individuals, laser treatment has the upper hand over the gold standard TURP.